Good morning, everyone, and thank you for joining us. For over a year and a half, staff at the Windsor-Essex County Health Unit have been working tirelessly to keep our community safe through an unprecedented global pandemic. Under the bold direction and leadership of Dr. Wajid Ahmed and the Health Unit's senior leadership team, the Health Unit has navigated our community through an uncertain and complex time, always keeping public health and the safety of our community at the forefront. I'm here today as the chair of the Board of Health to announce a significant change to our Health Unit's leadership. The resignation of our Medical Officer of Health, Dr. Wajid Ahmed, effective on October 1st. It is with gratitude, sadness, but also pride that I bring this news to our community, as this news comes with an announcement. While Dr. Ahmed will be leaving the Windsor-Essex County Health Unit as Medical Officer of Health, he will continue to serve our region and the province of Ontario as the new Associate Chief Medical Officer of Health for the province of Ontario, working alongside Dr. Kieran Moore, the Chief Medical Officer of Health. Since 2014, Dr. Ahmed has been an outspoken source of credible information, guidance, and professionalism. Through his work on public health issues like opioid pandemic, cannabis legalization, community water, fluoridation, climate change, and of course, COVID-19. He remains steadfast in his decision-making, using the best available evidence to guide his team, the wonderful, hardworking staff here at the Health Unit. But he did not do this alone. The leadership team at the Health Unit is strongly positioned to continue this great work under the new Medical Officer of Health. And I want to assure the community that under the leadership of our Chief Executive Officer, Nicole Dupuy, the Health Unit has never been more able to adapt to challenges and respond to public health issues. The Board of Health will be working with a recruitment firm to recruit and hire a full-time Medical Officer of Health, and will be starting the search expeditiously. And to ensure the community, our programs and services within the context of the global pandemic, the Board of Health has approved the appointment of an acting Medical Officer of Health to act as a consultant to the Health Unit during this transition. I am pleased to announce that Dr. Shankar Nazaturi has agreed to serve the community of Windsor-Essex as our acting Medical Officer of Health. Dr. Nazaturi earned his medical degree from McMaster University and also holds a Master's of Public Health from Harvard University. Dr. Nazaturi is currently a member of the faculty at McMaster University and most recently served as the Medical Officer of Health of Hallam and Norfolk Public Health Unit. Reflecting on the weight of the decisions made, their consequences, the countless hours, scrutiny, and commitment asked of his position over the past year and a half, I would like to sincerely thank Dr. Ahmed on behalf of the Board of Health for his contributions to our community and the sacrifices that made throughout this pandemic. I would also like to congratulate him on his achievement in his career and know that Windsor and Essex County will always be top of mind as he makes decisions at the provincial level and guides Ontario through a fourth wave and ultimately into the provincial public health system's recovery from this pandemic. We want to assure the community that despite any challenges, the team at the Windsor-Essex County Health Unit and the operations of the Health Unit are on solid ground. As always, the health of our community and response to the community will remain our top priority. Along with Nicole Dupuy, I'll now accept any questions from the media regarding this announcement, and Dr. Ahmed will be joining at 10 o'clock to provide his epidemiological summary and answer any questions that are asked of him. Thank you.
We'll now take questions from the media. Today we'll start with AMA 100.
Okay, thank you, and congratulations to Dr. Ahmed. I guess first, unrelated, kind of related. Can we please get the spelling of the new doctor?
It's Nesathuri.
Okay, thank you. So I guess just first off, this is obviously something that may or may not have come to a surprise as everybody there at the health unit. And I know, Mayor McNamara, you made comments that, he's going to help lead us through the fourth wave of the pandemic through provincial avenues now. So how confident are you that, Windsor-Essex will be able to continue to hopefully make progress despite seeing some increase in cases right now towards battling COVID-19 as we head into the fall and, the new school year in a very precarious time and in this pandemic?
That's a good question, and certainly, as you can see, and I've alluded in my comments, that we have a very, very strong leadership team here and a tremendous staff within the health unit. It's bittersweet to see Dr. Ahmed leave, but the announcement that was made that there's be really a seamless change. Dr. Nesathuri will be attending before Dr. Ahmed actually moves to his new career move to Toronto to sort of get the feel of our region. But again, the staff here, I have, and myself, our executive and the board have full confidence that our transition will be seamless and it'll be business as usual. Yes, we're in the midst of the beginning of a fourth wave, but again, Dr. Ahmed's not going to be too far. He's just 3 hours down the highway. He'll still have us top of mind here, but nothing's going to change. The health unit will continue to work steadfastly, in the community to make sure that we put in place all of the safeguards required to keep our community safe. So full confidence. If anything we've learned in the last 18 months, this health unit can pivot very quickly, and they've done that. We've gone through some very hectic times, and they were able to adjust and manage and deliver.
I guess just expanding on that a little bit, when Teresa left and Nicole took over, we all, at least from a media perspective, we knew Nicole. Nicole was already here, knew the region, had been with the health unit for a number of years already. So as you've mentioned, this new acting medical officer of health will, be having to come to this region. Mm-hmm. So can you give us a little bit more of that timeline on how much time the new doctor will be spending with Dr. Ahmed, shadowing or training or, doing whatever it is he can to get up to speed on what's happening here in Windsor-Essex?
I'll defer that to our CEO, Nicole.
Hi, thank you for your question. So as Mayor McNamara said, we will have an overlap with Dr. Ahmed. Dr. Nesathuri, I will get his name correct, is not unknown to us in public health. So he was the former medical officer of health for another health unit, and so is certainly familiar with the pandemic and understands what it takes to lead public health through an emergency such as this. We're really grateful to have him on board and excited. But just to reiterate, he's not unknown to public health and not unknown to us. He will learn a little bit about Windsor-Essex and our region, some of the challenges that we've had here. And I feel confident that our leadership team can work closely with him to bring him up to speed rather quickly.
I just want to add also, Norfolk, Haldimand County, and Essex County have a lot of similarities. They have a lot of migrant workers and farms, and they were impacted quite similarly to us here. So he's certainly well versed, and he's a medical officer of health with a lot of years behind him. And so again, I think the transition will be very quick.
Okay, thank you both.
Any questions from CTV?
No, not at this time.
Any questions from CBC?
Yes, apologies if I missed this, but is there a timeline in mind for when you would like the new permanent medical officer of health to be in place?
I'll defer this to Nicole.
So we are working expeditiously on the recruitment process. Our board has approved the hiring or the engagement with a recruitment firm for the recruitment of a permanent medical officer of health. So you'll see that recruitment start right away and go up. Certainly it is a position that requires a little bit of time, so the recruitment will be up for about a month, but we're hopeful that within a few months, our goal right now is by the end of the year that we would have a permanent medical officer of health for our health unit, and we'll again work with our acting medical officer of health through the transition during that time frame. So we will have the posting up for a minimum of 1 month, work with the recruiting firm to see it forward, and hope by the end of the year we'll have a replacement.
Thank you very much.
Any questions from CFTV?
Not at this time.
Any questions from Blackburn?
Yes, good morning. My first question would be, when you do have the permanent medical officer of health in place, what happens then to Dr. Nazatori? Does he become, take another position? Does he go back to Haldeman Norfolk? How does that work?
Well, actually, he is also a professor at the McMaster University School of Medicine, and so it's a mice. He'll continue his work with McMaster University.
Okay. And also, when did Dr. Ahmed come to the board to hand in his resignation?
That was a week ago.
Thank you very much, Gary.
You're welcome.
Any questions from the Windsor Star?
Yes, good morning to you both. Can you comment on the quest for hiring an associate medical officer of health? Does that work continue? And do you anticipate that you'll actually be able to hire an associate medical officer of health while you're trying to hire a new permanent one?
Well, that's a great question. Yes, we are going to continue. And obviously at this stage here, coming in with a MOH and others that are going to be, I'm sure, interviewed. So obviously hopefully we can do a double recruitment. And so we're going to continue, obviously, to hire an associate. We certainly know the workload is very high, and we still have a lot of work to do to clear ourselves of COVID-19 and many other challenges that our health unit is faced with. Obviously, the opioid crisis is very significant in our community, and so there's a lot of work to be done. So the quick and dirty, yes, we're going to continue.
Thank you.
Okay, we're going to take a slight pause, and then Dr. Ahmed will be joining us to provide the weekly epi summary. So just stay on the line and we'll be right back.
Welcome, everyone. Thank you for joining us today. I'm Nicole Dupuis, Chief Executive Officer of the Windsor-Essex County Health Unit. Today, we are reporting an increase of 69 new cases of COVID-19 in Windsor and Essex County. 22 are close contacts of a confirmed case, 9 are community acquired, 2 are outbreak related, 1 is travel related, and 35 cases are still being investigated. We have had a total of 17,500 cases since the beginning of the pandemic. 353 people are active at this time with COVID-19. To date, we've had 2,260 preliminary or confirmed variants in our community among our cases. 260 of those are Delta. 7 people are currently in hospital and 0 people are in ICU. Unfortunately, we are reporting an additional death due to COVID today. A woman in her 50s has passed away. We would like to share our condolences with her family and loved ones. We have lost a total of 438 people due to COVID in our community. There are currently 8 outbreaks, 6 workplace outbreaks, 1 in long-term care, and 1 in the community. For our vaccine update, we've had 292,819 people have received at least 1 dose in our community for COVID-19 vaccine. Overall, 78% of eligible residents 12 years of age and older in Windsor-Essex have received at least 1 dose, and 70.5% of eligible residents 12 years of age and older have been fully vaccinated in our community. The Province of Ontario and Ministry of Health have provided a number of updates in this past week to respond to the changing landscape of COVID-19 in Ontario and ensure we can continue to do everything we can to maintain the health and safety of our residents. These new changes and announcements include new case and contact guidance for Ontario health units, including changes to isolation requirements for those that are fully vaccinated versus those that are not. In short, these changes mean that individuals fully vaccinated, that's 2 doses, plus 14 days, may not be required to isolate if exposed to someone with COVID-19, but rather directed just to test and self-monitor. This certainly has big implications for those that need to continue to work or attend school. Eligibility for vaccine has opened up to those born 2009. As well, the province announced 3rd doses for select vulnerable populations, including transplant recipients and residents of high-risk congregate settings. The WICHU is currently working with our hospital and healthcare partners on the plans for 3rd doses, and of course, we will keep you updated as those plans are announced, and watch our website for updates. As well, the province announced a requirement of vaccination policies for certain high-risk settings, including hospitals and home and community care. With the 4th wave upon us, schools preparing to reopen for in-person learning, and more businesses and workplaces operating in person, it has never been more important to be vaccinated and to continue to adhere to public health measures and guidance, including masking, keeping distance of 2 meters from those outside your household, and washing or sanitizing your hands regularly. By protecting yourself and getting vaccinated, you are also reducing the impact on others in your life. If you are not yet fully vaccinated, please get vaccinated today and don't wait. There are appointments available to book at wevax.ca, or you can walk into the mass vaccination site at Devonshire Mall, and for the next today and tomorrow at Nature Fresh in Leamington. If you have questions related to the safety or effectiveness of vaccine for you, contact your doctor, your healthcare provider, or call the health unit for more information. To book an appointment at a mass vaccination site, please visit, again, wevax.ca, or call 226-773-2200, and know that our sites are also accepting walk-ins. Lastly, I want to thank all of the hard work of the health unit staff over the past many months to support our vaccination efforts, case and contact management, and regular programs and services. You have been steadfast and dedicated throughout the pandemic and deserve our gratitude and appreciation, so thank you. I also want to express my thanks to Dr. Ahmed for his fearless leadership this past year. And I will now turn it over to Dr. Ahmed for our weekly Epi Summary. Thank you.
Hey, good morning, and thank you for joining us. I will just dive right into the cases, what we're seeing. As Nicole mentioned, we're already starting to see the effect of 4th wave. and cases are increasing in our community. So just taking a quick look at what's happening worldwide. And obviously the cases are increased everywhere, more so in US and some of the other countries. Some countries are seeing a decline in the overall cases, but still it continues to remain at a level which is concerning. We are starting to see some of the other countries like Canada, Germany, and Italy also seeing an uptick in the cases, including Japan, which has done remarkably well in the beginning of the pandemic. Converting that data into the hospitalization data, we can see that hospitalization is also catching up. And we know the hospitalization is a lagging indicator. That means whatever we are seeing, we'll see the impact of it later. The other important distinction from a hospitalization indicator perspective is that most of the people, or almost all of the people who are vaccinated, the likelihood of them developing severe disease is very low. So we may not necessarily see the same impact which we were seeing before. So despite some of the cases that are popping up in the vaccinated population, the impact of these cases are much lower than what the impact is on the unvaccinated population. So pretty much we can see that what we are seeing is the pandemic of the unvaccinated people. Similarly, now equating that hospitalization into ICU beds, and we can see that the ICU beds also continues to increase everywhere, including Canada. Canada is also starting to see the uptick in the ICU beds, and indicating that the situation will continue to get worse, despite due to the large number of cases that are happening not only in Windsor-Essex but also in everywhere else. From the main culprit for all this fourth wave is the Delta variant, and as we have seen in almost every country, once Delta starts to spread, it basically takes over and becomes the most dominant strain that affects everyone. So far, the vaccine has been fairly effective against the Delta variant, but we definitely need a much higher number of people vaccinated, double vaccinated, to prevent the ongoing spread of Delta variant. Even we are touching close to 80% mark in our community with first dose, 72% with the second dose, but we need at least 85% fully vaccinated to really prevent the ongoing spread of Delta variant. We recognize that this is not something that can be achieved on its own without any support. So more details on the contribution of Delta variant in each of these countries. As you can see, UK, 100% of the cases that are circulating are Delta variant, and we are still seeing some activity of Alpha variant in Japan, but predominantly still Delta continues to be the most dominant strain worldwide. Looking in Ontario, we are seeing that the cases are increasing in Ontario, and the current 7-day average for Ontario is about 498 cases a day. And definitely this has increased from last week when it was 375 cases per day. Now focusing just on Windsor-Essex, we can see that the cases are rising at a rapid rate, and what we are looking at is the 7-day average, which is at 43.6 cases, which is more than double from last week. And all of that, if we can tie it with the timeline, so we can see since we moved into step 3, the cases starts to increase because now there are more opportunities for people to get together in settings which is more of a risk and continues to contribute to the spread of COVID-19 in the region. Just looking at a closer look at how the slope is increasing since the beginning of the month, July. So July we did pretty good. Starting August, things are starting to get worse. From a case rate perspective, the slide basically captures week-over-week incidence per 100,000 population, and right now our most recent completed week, which ends on Sunday, our weekly case rate is 58.1 cases per 100,000 population, and this is a huge increase from last time when we were at 30.3 cases per 100,000 population. Just looking at the past 7 days, we continue to see the upward trend, and just in the last 7 days, our rate is at 69.4 cases per 100,000 population. Again, this is a huge increase when we were, before we were at 37.3 cases. So ongoing trend that is showing that the cases are continuing to increase in our community, and it all started since we moved to step 3, highlighting some of the importance that what we need to do to prevent some of these cases. Quick comparison from where we are, Windsor-Essex, we did very well for the third wave. We even went ahead in the month of July when everywhere else cases was increasing, but now we are seeing the opposite trend. Windsor-Essex County rate is increasing much more rapidly than the southwestern region as well as in Ontario. So translating that data into the wastewater data, and as we have said before, it's a pretty good reflection of what's happening in the community. And even if whether we are picking up the cases directly from the surveillance testing or not, but this shows what the wastewater data shows for our community. So the wastewater data is aligning very well with our case rates that we are seeing in the community, and continues to see an upward trend. We are seeing a blip right in the end. But again, that could be just one blip, or it could be a trend. We'll have to wait and see for additional data to make that a certainty. But we know because of all the high-risk activities that are happening, we may see the trend continues with the case increase. Our person positivity is also increasing, and for the week ending on August 14, our person positivity is now high up to at 6.5%, and this is more than doubled from the last time when it was 3.7%. And last week, we have seen an uptick in the testing as well. We tested more than 4,000 specimens last week. From a person positivity data in Ontario, Windsor-Essex has the highest person positivity at this time in the province with the high case rates, which is pretty much reflective of what we have said before. And more specifically, the person positivity is very high among the 18 to 34 age band, which is close to 12 to 13% that we are seeing in that age group, followed by the unvaccinated group for the most part, 0 to 17. And then, as we can see, the 65 plus, where we have the highest vaccination rate, that person positivity is really low in that population. From a cumulative regional and provincial rate perspective, we are still at number 4 from where the provincial data looks like. We are above the provincial average with respect to the regional cases. Breaking it down to the municipality, starting all the way from August, the highest case rates are coming from the city of Windsor, LaSalle and Leamington, followed by the rest of the municipality, which is pretty much somewhat similar to each other. We're also, from a case distribution perspective, obviously, city of Windsor contributing to almost 2/3 of the cases, while the rest of the municipalities have a pretty much equal share of cases in the community. Just in the last week, we see similar pattern, no change, except some minor fluctuation in some of the municipal data. In the last 2 weeks, most of the cases that we're seeing, it's no surprise to us, and I think we have said it even in the past, that the most of the activities that we are seeing is between the ages of 20 to 29 age group, and in the last 2 weeks, that contributed to almost 30%, 37% of our overall cases. 0 to 19 is the second highest proportion of cases, but please remember that 12 and under are not even eligible to receive the vaccination, and we are seeing younger people who are ineligible at this time to receive the vaccine coming up with some cases, and some are really little kids, younger than 1 or 2 years old, that are now coming back positive because of the exposure and because of some of the activities that are happening in the community. From an exposure perspective, lots of cases recently, so there are a lot of cases that are still under investigation, and our team is working hard to get to all the cases, and as Nicole acknowledged, that our team has really been busy in trying to stay on top of everything, and the case and contact management is getting more and more challenging as we are in the current reopening framework, which is step 3, and that means lots of contacts, that means lots of potential exposure source, that means lots of back and forth in terms of identifying where these exposures are happening and what kind of control measures that need to be placed. So as much as it's important that people continue to participate in some of these activities, but the challenge of having so many contacts, it's giving much more, making it much more challenging for our staff and for us to follow up on all of these cases. So just a reminder, as we have always said before, try to minimize your contact as much as possible. Obviously, there are certain guidelines or certain allowances in what people can do and cannot do. Please be mindful, but your best option is, especially when the cases are increasing, try to limit your contact as much as possible. From a source of acquisition perspective, almost 1/3 of the cases are still coming from the community. It's no different than what we were seeing before. The most important part is because of the Delta variant, once a person bring it into their family, pretty much the entire family is impacted by it. So that's the no different than what we were seeing before, but because of the high transmissibility, it's almost certain that if one person is infected in the family and the family is unvaccinated, everyone will get the virus. With respect to hospitalization, it's increasing, and we're seeing the impact in Windsor-Essex too. From a day-over-day doubling time perspective, obviously the lower doubling time means we are doing worse, and we can see Windsor-Essex as a number has dipped down further below the provincial doubling time as well as Canadian doubling time. So right now we are at a stage where we are performing below, or we are performing worse than the province and Canada. And there was a time, for a long period of time, we were doing much better than the provincial and the federal average. From the median reproductive rate, we are, the most recent estimated median R0 is 1.46, and this is slightly lower from last week where we were at 1.62, but overall we're still above 1. That means there are more cases in the community, and there will be more exposures, and the cases will be on the rise. And as more and more people are getting sick from them, so let's say even on average, if 50 people are getting are currently coming back positive in a day, they will generate more cases, almost like 1.5 times more cases the next time. So in the next cycle, so indicating that we will continue to see ongoing positive trend and people contracting more COVID in our region. So now quickly on the vaccine status, we globally, Canada has the highest vaccination rate among many of the developed countries with at least 1 dose, and also with 2 doses are what we're considered as fully vaccinated, even higher than the countries like Israel. What's happening locally is we're starting to see a decline in the overall daily vaccination rate, but we are still administering about 380 first doses in our region in the past 7 days, and which is similar to what we have seen in the last week. With the new announcement, as Nicole mentioned, with the increased eligibility for children, as well as some of the requirements that are set up by the province, we'll see more uptake in the daily vaccine administration dose, but it is the time that, especially for children, before they start school, if they're still waiting for the vaccine, they must get it as soon as possible. The time is ticking, and we want to have a better system and a safer school when everyone is vaccinated. So looking at our overall daily dose administered, we administered last week 990 doses on an average, which is compared to 1,100 doses last week. So again, it's overall the number of vaccine administered is declining in our community. And this slide further breaks down by the how we are doing with the first and second dose. Obviously, our first dose has plateaued while we are seeing a decrease in the second dose being administered, understandably. But we are seeing some new first doses, which is great, but there's still a long way to go. We want to maximize the number of people. And as I mentioned, we need 85% fully vaccinated to prevent the impact of fourth wave. So from our Windsor-Essex residents who have received at least one dose by age group, we can see the gradient effect with older age people having the highest vaccination rate. And as a result, we are seeing less and less cases in these age group, but the younger age group where we have the lowest vaccination, that's where we are seeing most of these cases. More than half of these cases are now between in individuals who are under the age of 29 or under the age of 30. So, which is a significant concern, and because of the reopening, a lot of these people, a lot of these young adults are active in the community. So, be mindful of all their activities. So this is another way to show that the plateauing effect of which age band is getting the vaccine. So we continue to see an increase in the 12 to 17 age group, but the older age group, we are seeing the pretty much the decline in or plateauing effect of new first doses. Windsor-Essex residents that are fully vaccinated, similar graph, but slightly lower number, as understandable, because there are still people who are waiting to get their second dose. The eligibility has definitely opened up, and if they are eligible, if they're past the 28 days mark, they can get the vaccine immediately from our clinics. Another way to look at the number of population that's fully vaccinated, similar picture, we continue to see some increase in the younger age group, while the plateauing of in the older age group. So this graph basically gives you a breakdown of what the situation looks like for those who are fully vaccinated versus have received the first dose versus second dose. So clearly more people received the first dose versus the second dose, and that number needs to be improved to prevent the impact of Delta in our community. So similar picture in our Windsor-Essex hotspots, we continue to see increase. We have some gains, but still some of the areas require some ongoing work. And working with our partnership with the health unit, with mobile strategies and many other initiatives, we continue to increase our coverage rate in these communities, which will be an ongoing work and will take some time before we get to the level where we'd like to see them. And similar picture for the second dose, pretty much the same coverage rate, but slightly lower as expected for the second dose. So from the COVID-19 vaccination rates and the cases that we are seeing as understandable that because of the reopening, we are starting to see an uptick in the number of cases. So it's clearly the beginning of the fourth wave, and we all need to take actions to prevent the ongoing spread of the disease. So from a percentage of adults that have received at least one dose by public health unit, we are slightly below the provincial average. I would say maybe not in the middle of the pack, but anywhere between middle to the 3/4 category. And similarly, with the second dose, similar picture, we are slightly below the median at this time. In summary, the case rate has significantly increased, and with all the indicators that are pointing that it will continue to increase in the coming weeks. Our wastewater surveillance data is also reflecting the same trend. Our hospitalization is low, but we are seeing that it's starting to pick up. We have now people in the hospital and in the ICU as well. Our first dose vaccination rate is increasing slowly, which is something that we need to pick up. Second dose vaccination coverage is still low. We need high, and anyone who's waiting for their second dose should get their second dose as soon as possible. From a monitoring indicator perspective, as I indicated, our most recent completed weekly case rate is 58.1 case per 100,000 population, clearly a very high number. And almost 80% of these cases that we are seeing is among the people who are unvaccinated. Our most recent 7-day rate is 69.4 cases. Our percent positivity is highest in the province at this time with 6.5%. And our most recent percent positivity is 5.1%. Our R effective, as I mentioned, 1.46. Our outbreaks are increasing, including one of the outbreaks that we have reported in the long-term care home, as well as some of the community outbreaks. Our vaccination coverage rate is 79.3% with at least one dose, and this is between the the adults right now, and then 72.2% of Windsor-Essex adults that are fully vaccinated. And in a nutshell, basically, what I would like to say that we are at a very critical time, and I've been saying this for some time. The cases are increasing. Cases are on the rise, and it's among the unvaccinated mainly. So we need to increase our vaccination rate. And those who are vaccinated, it's not a free pass either. So you have to be mindful that you can still contract COVID. You may not develop the severe consequences, but you may pass it on to someone else. The likelihood of passing is still low, but you never know who you can pass it on to and if they develop any severe consequences. So some of the public health measures that we continue to reiterate: physical distancing, by far the most effective measure, that you must maintain physical distancing for people who you don't know or people who you're unaware of their vaccination status in any type of indoor environment. For the second is in any type of environment, if you cannot maintain physical distancing, wear a mask. More specifically in the indoor environment, some of the cases that we are seeing, and as we continue to investigate these based on the exposure, these people are everywhere. These people are going into many different settings and potentially exposing many people during their infectious period. So it's absolutely critical that while we still have lots of opportunities, activities, openings, we are doing that in a safe manner, in a responsible manner, and still protect ourselves and also protect others around us. Thank you.
We'll now take questions from the media. Today we'll start with the Windsor Star.
Yes, good morning, Doctor. I'll start off by saying congratulations on being hired as the new Associate Chief Medical Officer of Health, for the province. Start off with, how are you feeling about this career move?
Well, it was a very tough decision and truly a bittersweet experience. As much as it's a good career move, but I also am indebted with the love and support that I receive from the community. Windsor-Essex is one of my home, and I feel the pain, I feel the passion, and as much as I am happy, I'm also sad to leave a community that is very, very supportive and have gone through some of the difficult time in the pandemic. But my heart and my mind will always be with my community. And we have got a great leadership team. So everything that we have accomplished, we haven't, it's not on me, it's my team. It's my team. They have done an amazing job keeping our community safe. I may be the face, but all of the hard work that has been done by our staff. So I'm confident that they can continue to steer the community in the right way, and I'm truly honored. And it's a pleasure of me to lead the health unit through this crisis. I'll still be worrying about Windsor-Essex for sure, despite in my new role, and formally and informally, I'll be connected with the health unit regardless.
And do you have any thoughts on what you're looking to discuss at the provincial level and what you're looking to achieve there in terms of the new role you're taking on?
So there's a lot of work that needs to happen at the provincial level, as well as we know our new Chief Medical Officer of Health, Dr. Kieran Moore, took the office, and while we are still dealing with the pandemic, obviously when things were moving in the right direction, We were thinking more about the recovery planning, what it means for the entire province to move back to some kind of a normalcy, and what would it take to get us there, what kind of systems that we need, what kind of support that we need from a public health perspective. So that was the goal. But now seeing the beginning of the fourth wave, I'm sure that the attention will be the immediate concern, which would be to how do we protect our community, how do we protect our province, save lives, how do we protect our healthcare system? That would be the top of the issue for everyone. And as you know, some of the critical stuff is the economy. Some of the critical stuff is ensuring that our children continue to get the education. They have lost many months during this pandemic. It's a big loss. What can we do to keep our school system safe? What can we do to ensure that the entire province is safe? The response, the COVID-19 response of Ontario is probably, in my opinion, one of the best response in the world with respect to the population, the challenges that we have seen here. We have come a long way, and I think we just need to carry that forward, and we need to continue to be the leader, not only in Canada, but also in the world.
Thank you.
Any questions from AM 800?
Yes, again, congratulations, Dr. Ahmed. I am wondering, the person who was reported as the new death today, a woman in her 50s, was she from the community, and do you know her vaccination status?
I don't have that detail, so my apologies. I'm just trying to see if I can pull that information.
She's from the community.
She's from the community, yes. Yeah, she's from the community.
Okay. While you're looking up her vaccination status, I'm also wondering, lots of different organizations, governments, municipalities and whatnot, coming out saying that it is mandated that staff are vaccinated. I'm wondering if you are tracking the vaccination status of health unit employees, and if mandating vaccines or coming up with a policy is something that will be put into place.
Hi, thank you for your question. So just like other workplaces across the province that serve vulnerable populations, we are looking at our own policies and practices as it relates to immunization, and that includes COVID-19. So it's something that we're discussing along with workplaces across the province. We haven't tracked, we don't have a tracking of our employees at this point in time.
Okay, so you don't have an idea of what percentage of health unit employees at this time are or are not vaccinated?
No.
In looking into all of that, do you think it is a possibility that you will be asking them to disclose vaccination status in the future?
As I mentioned, it is something that we're looking into, our own policies as it relates to vaccination, and should have more to share in the future.
Okay, thank you.
Any questions from CTV?
Yes, first off, again, congratulations on the new position. Overall, any last words to the public here in the city of Windsor prior to your leaving in October?
Well, I think it cannot be my last word. I'm sure that there's a lot more that I still have to do and will continue to do. But I think what is critical, that yes, it's me leaving and you know, the transition and everything. It's important. What is really important is for our community to get out of this pandemic in a way that you know, minimize all the consequences, whether we're talking about the economic consequences, social consequences, health consequences, everything. That would be the most important message to me. We have done a lot together. Our community has really risen above all the challenges what we have experienced. some of the challenges that our community has seen, no one else has seen in the province. So I truly appreciate the patience, and want to thank the public in a big way for doing everything that they have done to get out of this pandemic. And that work hasn't stopped. The cases are still here. The pandemic is still impacting the entire world, and more so in our community. So we definitely need to work together. We need everyone's support. We need to keep our economy open. And on the same time, we want to keep the cases in check. So the best thing that you can do is get yourself vaccinated if you haven't done that already. And for those who are vaccinated, please, the pandemic is not over yet. You still have to follow some of these same practices and make it a part of your practices. You don't go to in setting where some of these measures are not followed, especially if you are not even sure about the vaccination status of people who's coming in, who's going there. In any kind of public environment, when masking and physical distancing is not followed, the risk is significantly high, and that is reflected in every investigation that we are doing. So I'm sorry, I'm not talking about my thing, but I think it's important that the community recognize that we are at a stage where things will get worse, and as we have said it many times, hospitalization, ICU deaths are a lagging indicator. So whatever we are seeing, we may see the impact 2-3 weeks at least, or a month down the road. So we don't want to be in a situation where it will take a lot to rotate the dial back to where we were before. So every action that we are doing right now will help us prevent the ongoing spread of COVID-19 in our community.
Okay, now that the City of Toronto has announced mandatory vaccines for its employees, there has been talks on the municipal level about that happening similarly here in Windsor. What are your thoughts on that?
So I think that's definitely a great move, and we know that vaccination is the number one defense that you can have against COVID-19, and having a much broader policy that is that's everywhere, it just makes it easy from an implementation perspective, from a safety perspective. So I truly want to support everyone who is moving in that direction, because that's the right thing to do. And clearly there will be some people who have medical exemptions who may not get the vaccine. So those are there needs to be some consideration in how we are addressing those individuals. But mind you, the medical exemption pieces are very, very few. You can even just count them on your finger, like how many medical conditions would prevent you from getting the vaccine. But the majority of the people who have not the right information, those are the people I think we need to make sure that they get the right information to get the vaccine and keep our society safe. We definitely want to support our businesses. Our businesses have suffered a lot. Our community has suffered a lot. From a social perspective, we have suffered a lot. Like, we haven't met many people because of these restrictions. So we want to maintain all of that, and we want to keep all of that.
And do you expect any pushback from employees at the City of Windsor?
Well,
if that policy is implemented?
Well, I guess there's always someone who doesn't like the thing that the broader public is doing, but the policy is the policy. There are certain requirements for certain jobs. The employer can pose certain restrictions, and as long as they are following all those policies and putting all due consideration, I think it'll be fine. We can have all sort of opinions and all sort of powers on what I want to do, but when you're talking in any kind of public domain, there is a risk. If you are unvaccinated and if you get sick, there's a risk that you will put onto other people. And I think that's in my mind, that's basically the crux of the argument. You can stay home. You don't want to get vaccinated, fine. Don't leave your home. Don't do the things and put others at risk. So I think that's the critical message. There are people, and some would argue that if you're vaccinated, why are you worried? Well, there are other people who cannot get vaccine, not because of their choice, because of their medical condition. They are weak people, they are vulnerable people. You don't want that, because of your action, somebody dies. Like, and that's on you, like, because you willingly, intentionally, knowingly, you did some high risk, participate in a high risk activities that led to someone getting hospitalized or dying. So I think the pushback will always be there, but I truly hope that people understand that there are certain obligations. You can have your own personal choice, but when you're talking about your choice impacting others, you have to take consideration. You cannot do that, and you cannot put others people at risk.
And do you support employers if they decide to make changes to employment statuses if someone decides not to get vaccinated? So, for example, if the city of Windsor decides to put this policy into place, if they have the authority or they decide to terminate people because of their vaccination status, we're seeing that happen in other parts of the province. Do you support that decision?
So that's more of, I think, a labor relations situation rather than a health situation. I think from a health perspective, I do support people getting the vaccine, but some of these consequences, I think that's more of a labor relation issue that I don't think that I have the expertise to comment on that.
Okay, and just to follow up, I believe, Christy, were you able to figure out the vaccination status of the 50-year-old who passed away?
No,
The woman in the 50s?
at this point, no. We'll have to circle back on that one. But it's as we reported in the past that there are certain challenges with the with confirming the vaccination status of everyone.
Okay, so that still hasn't been approved, obviously.
Yes.
That you guys are able to release that info.
Yeah.
Any questions from CBC?
Yes, good morning to the both of you, and congrats to you, Dr. Ahmed. Looking at these numbers, are you considering implementing any new public health restrictions? Is there any kind of firm criteria or some kind of threshold that you're looking at where you'd say, we need to take action to prevent further transmission?
Well, we are looking at the data. We look at the data every day. We go through all the exposures. We go through all the locations that are being identified. We go through some of the high-risk activities that people are involved in. So it's an ongoing discussion. There's a much broader discussion that's happening at other tables as well, that what do we need to do as a province, what do we need to do as a region to have some policies in place or some control measures in place. So it's an active discussion. We always look at it, but right now, as I said, it's all over, and it would be much easier if people follow some of those public health measures. And I think that's the critical part. What we are noticing is, people know that they should follow, but they are not following that. And again, it's not like a violation in some way, but those are just common sense. Those are just simple things that people can do to prevent the ongoing spread. So if you are supposed to mask around people that you don't know, you should. If you're supposed to maintain your physical distancing, yes, you should. So those are some of the like easy fix that we can do instead of taking in or implementing any kind of broad measures. But we continue to look at it, and if needed, we will implement some of those measures to ensure the safety and well-being of our community.
Thank you.
Any questions from CFTV?
Yes, first of all, congratulations, Dr. Ahmed, on your promotion. And I have two questions today. First one is, what does the data have to indicate before there's another lockdown or step back from the step 3 reopening?
So those markers haven't been set by anyone, including myself. We do talk internally about what would be our threshold. So there are certain things that we are looking at. And again, it's not just the absolute case counts that we are looking. There are other indicators such as the outbreak, our capacity, our hospitalization, ICU, and whether some of these measures will help to curb the spread of COVID-19. So those are ongoing stuff that we are looking at. But right now, I don't think that anyone has landed on any set criteria or indicator to say if we pass that, then we will have to do something.
Okay, thank you. And the other question is, when will people outside of nursing home settings, like the general public, with respiratory difficulties such as COPD, asthma, when will they have access to a booster? If they've already had, the 2 vaccines, when will they have access to another booster?
Yeah, so that's again, it's an active discussion at this time at various level, provincial level, federal level, and there may be some consideration on the booster dose. Right now, from a scientific data perspective, there is some clear evidence on individuals who are immunocompromised that their immunity starts to wane after some time, and that's why the recommendation for a booster dose for those individuals. For our broader public, I think the scientific rationale is still evolving, and if we have a scientific rationale, or even if it's based on the expert recommendations, a decision will be made. But right now, as of today, I am not aware of any Canadian authorities endorsing or supporting vaccination or a 3rd dose booster for individuals in those categories as you mentioned.
So someone that has COPD, there's nothing there for them for a 3rd dose if the COPD is severe.
Well, at this
we don't have to really worry about it.
Well, I think the worry would be there, but it may not necessarily be that a booster dose will be something that they need. Their body should have the immune response as the general population. They have to be mindful of some of the I shouldn't say non, but they need to have be mindful of the other public health measures such as masking and physical distancing piece. As I said, it's an active discussion for a 3rd dose, and if and when the province announce it or the federal government announce it, our team would be ready to give out the vaccine as soon as possible for a 3rd dose booster for whoever the eligibility would look like. But at this time, the 3rd dose booster is not indicated. They still need to follow the same public health measure, in fact, more than the others, of masking and physical distancing than the rest of the population.
Okay, thank you very much. No further questions.
Any questions from Blackburn?
Yes, Maureen wanted me to ask you, and I think I know the answer to this already, but she wanted to know, since the college and universities have announced their vaccine policies, has there been any uptick in residents in those younger groups getting their vaccines? Have you seen any uptick there since then?
Yeah, it's a good question. We anticipated there will be some uptake. I'll have to connect with my team to see exactly what they're seeing on the ground. We are, as I said, we are seeing new vaccines every day on a regular basis, close to 400 new doses every day. I don't have that breakdown of which age group are getting the most vaccine, but I would imagine it would be the younger population, but I'll have to double check with my team before I can say with certainty.
All right. So, my next question is about Rick Nichols. And as you know, yesterday he was expelled from caucus because he refused to get the COVID-19 vaccine. Now, Premier Doug Ford has said that he's going to let people make their own choice, but he wanted this for his MPPs and his candidates. But I wanted to ask you, what does it say to the public, do you think, when you have a high-profile leader like Rick Nichols who refuses it?
Well, I think our message has been clear right from the beginning that in order to prevent yourself, to prevent any complications or you contracting COVID or passing it on to others, developing severe consequences and unfortunately dying from it, the best defense that you can do is to get yourself vaccinated. So our message continues to be the same. And I think as we see some of these requirements set up by different authorities, different agencies, different workplaces, there will be people who may not want to get the vaccine for their own reason. But I think from the messaging perspective, it is absolutely critical that our message needs to be there. We need to show what we need to practice what we are preaching. So I can say that yes, I'm fully vaccinated. I can say that yeah, all my family members who are eligible to receive the vaccine, they're all vaccinated. And if I don't have that, I can't say it to others too. So I think we will see some of those challenges, but again, as an overall direction, everybody agrees in the scientific community, the best way to protect yourself against COVID-19 is to get yourself vaccinated.
My last question, and this will be my last because I've got to run and get my noons together, but I wanted to ask you if you have any advice for Dr. Nazatori and the new MOH coming in.
Well, Dr. Nasatori is a seasoned MOH as well, so I'll be basically just filling him in for the community in particular, that what our specific challenges are. I think he's very well capable of handling the role. My conversation will be more focused on what specific challenges we are seeing, what our approach has been, what worked, what didn't work. So those would be my conversation with him. But he's really a smart guy. He has done great job in his previous role. And I'm really happy that he accepted the interim role with the health unit. And I wanted to make sure that I don't leave the health unit without any support. So I'm glad that he took it on himself, and the health unit is in capable hand with the leadership that we have, especially Nicole and everyone in the leadership team. Our management team, our staff, we have done an amazing job throughout the pandemic. And as you can imagine, it cannot just be one person. So we are in a very good shape. And with Dr. Nasatori coming in, I'm sure that the community will continue to be as safe as possible in the pandemic.
Thank you so much, and congratulations, Dr. Ahmed.
Thank you.
Okay, given the timeline, we're going to end it here. Thank you, everyone. We'll see you next Friday. Enjoy your weekend.
Thank you.